Yeah, good evening and thank you all for attending. Thank you, Dr. Kunjal and Scientific Committee for this opportunity. So, as she won't be able to attend, I'll be covering her talk and then covering my talk subsequently. So, basically, this will be a overview of the different techniques to achieve a corneal tattooing. So, we have learned from the previous speaker that when to do it, when not to do it. So that is the probably the most important thing to do before any kind of ocular surgery. So with that, we will learn about the lamellar pocket and the surface pigmentation techniques. So like madam has already mentioned, please do not touch such type of eyes. So basically heavily vascularized corneas, eyes with intractable secondary glaucomas, anterior staphylomas, eyes which are already thusical. It's best that we try some other method of achieving cosmesis rather than doing a tattooing. So we have different techniques to achieve a tattooing of the surface. We have the chemical method of Galen or NAP, in which we are using the gold and the platinum salts. So the coloring method, that is basically we have carbon soot or India ink, and we have the tattoo dye. The powder is not easily available. We can use the liquid tattoo ink instead. So we can have a superficial tattooing which is achieved with the pigments. We have the transepithelial intrastromal micropuncture with the powder or the soot, which is not a preferred technique. You can make a lamellar pocket and then put the soot or the powder or the liquid dye into it, and you can use the tattoo gun, which is automated way to achieve the stromal micropunctures and use the liquid dye. So if you go to the lamellar pocket, we can achieve this pocket. You can create it by hand, just fashion it out with a crescent or a lamellar dissecting blade. You can use a microkeratome or you can use a femtosecond laser, which is quite fancy. So we are not covering this in the instruction course. Or you can, and to achieve this into the pocket, you can put the soot or the liquid dye or the India ink. But the caveat here is, if the scar is full thickness, you can construct a pocket, but there will always be the roof of the pocket which has the white opacity in it. So that again, to cover that, you have to do either a stromal micropuncture or use the gold and the platinum salts. So the pocket is, since the pigments are not exposed to the surface, the advantages are longer retention and less risk of recurrent erosions. So I'll just show you a video. So as you can see, there is this full thickness scar, and the surgeon is fashioning a lamellar pocket with a lamellar dissector above the level of the A, but obviously some part will still be visible, and now the powder is being pushed into the lamellar pocket to achieve the desired cosmesis. So here the depth of the dissection is extremely important. One should not go too deep, or just to avoid any perforation into the anterior chamber, and the roof of the pocket is being tackled with and the suture is being applied. The suture, you can put a bandage contact lens for better comfort. So this is basically a 30-year-old male who underwent VR surgery. So this is the result 6 weeks post-op with the powder, which was pushed into the lamellar pocket. So this again soot, as madam has showed, you can improvise it in the OT by using a candle. So this again, this eye was highly disfigured, and for cosmetic reasons, this was the outcome. So again, this was status post VR surgery, a non-seeing eye. So with the liquid dye, this is the result 4 months post-operatively. The other option you can have is using the reaction between the gold and the platinum chloride. The gold chloride gives a brownish color to the eye, and the platinum chloride gives a blackish color. You have to reconstitute in distilled water and refrigerate, and then autoclave the color before use. 2% hydrazine hydrate is used as a fixative. Both are applied each for a minute after you remove the epithelium from the cornea. Availability is always a concern, but this is definitely one of the methods you can use. So basically the precipitate, because of the reaction between the fixative, that is the hydrazine and the salts, the metallic precipitate is deposited into the keratocytes and between the stromal lamellae, and it's an easy and quick procedure. But yes, definitely, as madam has mentioned before, they are irritant to the ocular surface and can lead to recurrent erosions. You have to wash off the fixative because it is very toxic to the ocular surface. So this video demonstrates the use of the epithelium is being scraped up, and now by using a well so that the pigments don't spread elsewhere on the surface, this is being applied, and you can see this is a quick reaction which gives a color on the spot, this black color, and then after leaving it for a while you can just wash it off. You can mix and match so that it goes well with the color of the other eye. For Indian eyes, it's quite easy because they are heavily pigmented. For Caucasian eyes, it's a challenge to get the accurate shade. So the post-operative regimen in these procedures, basically you remove the BCL after a month. You give copious topical lubricants, topical antibiotics, cycloplegics, and once the epithelial defect is healed, maybe after the third or the fourth day, you start them on low-dose steroids and taper them over a longer period. And sometimes if the patient complains of pain, you can add oral NSAIDs. So this is again a lady who was blinded post VR surgery. So this is after 18 months. Upon close examination on the slit lamp, you can see the mix of the gold and the black color, but from a distance it all appears cosmetically acceptable. This was the pre-op photo. This is again status post VR surgery. This is 12 weeks, that is 3 months post-op. This is another photo of a patient who was having this leukomatous scar which is covered by the pigment. So basically tattooing is an excellent cosmetic option for disfigured eyes. We are evolving with better and newer techniques every day, but like any other surgery, a lot of repeated counseling is required both for the patient and the attender of the patient. Sometimes it's not the patient but the attenders who cause the most trouble in the outdoor. So basically you have to call them for repeated sessions, counsel them at each visit, and only when they are convinced about the utility of the procedure, only then you should move ahead with this. And the probability of a repeat tattooing should always be emphasized at each counseling, because nothing is permanent, so is this color, everything fades with time. So you have to keep counseling them and tell them ki yes, we can, it's a repeatable procedure. If it fades away, we can always repeat the procedure for you. And certain contraindications, as mentioned earlier, simply do not touch such eyes. Thank you. Now, till now we have been discussing eyes which are essentially blind either due to trauma or post intraocular surgery, or they are congenitally blind. So now in this next presentation I aim to present something in which madam has showed the indications, that is reduction of glare and photophobia is one of the objectives why we do tattooing. But obviously one has to be very careful. So I will just go into slideshow. Yeah. So I have no financial interest to disclose. So I will just start with the video. I think everybody can follow what is going on. Thank you.